Health 54, the program that lets you in on health-related issues across the 54 African countries and the globe right here on your digital-first Pan-African News Network, TOS Television. I am Rose Audu. The federal government has signed a memorandum of action with the National Association of Resident Doctors geared towards averting the planned nationwide strike of resident doctors due to commence Thursday, April 1. The agreement was signed midnight on Wednesday after a marathon meeting between the government side and the leadership of NERD at the office of the Minister of Labour and Employment, Senator Chris Ngige. Did this agreement hold water? Let's find out from this exclusive chat with TOS News' Ife Onyekweru.
Medical doctor strike actions had been relatively rare events in medical history. However, in recent times, over the past 2 decades, it has become a commonplace in most developing countries, including Nigeria.
Yeah, obviously, it's affecting the whole health system. I mean, you came to the hospital today, you've seen that some patients were discharged, some are not on, no clinics are running. So, these issues are issues that have been, some of them have been issues that have been prolonged. And, what we're simply asking for is, why not just make this work? We're talking about brain drain. People are leaving, doctors are leaving, and there are things you could do to make it easy for people to be in our country. It takes a lot to train a doctor, and then all of a sudden a doctor graduates, and then countries like the UK, US will just come and harvest your doctors. Some of us cannot go, some want to stay, and why not let's make this system work. I know that, as I said, there are negotiations ongoing. You understand, ongoing negotiations, but we must make it work, and not just work for the moment, but work continuously.
Health, they say, is wealth. The fate of the common man as well as resident doctors is as important as long as the country stands. Nigerians have taken turns to express their concerns about the ongoing strike of resident doctors in the country. Ife Onyekweru reporting for TOS TV.
The Nigeria Center for Disease Control and CDC reported 129 new cases of COVID-19 Wednesday, bringing the total number of infections in the country to 162,891. Nigeria has so far tested over 1.7 million people since the first confirmed case of COVID-19 was announced on February 27 of 2020. And CDC also confirmed an additional COVID-19 related death, bringing the death toll to 2,057 since the outbreak began in Nigeria. And according to a report by Nigeria's Center for Disease Control, the country has recorded at least 223 Lassa fever cases and 46 deaths in 2021. With 4 people dead in Ondo State as a result of the Lassa fever infection, the agency reviewed in its weekly report that latest fatalities were recorded between March 15 and March 21 of 2021. 32 new cases were also reported in 8 states during the period under review, with the highest in Ondo with 14, followed by Edo with 10 and Ebonyi with 3. And as Nigeria joins the rest of the world to commemorate the 2021 International Adolescent Health Week, some youth in the country have called on the federal government to create more youth-friendly centers where they can feel free to discuss issues regarding their health. As according to them, this will help the youth not to go into depression. In response to the appeal by the youth, the Minister of Health, Osage Ehanire, reiterated the federal government's commitment towards ensuring the welfare of adolescents in Nigeria, saying that the COVID-19 pandemic has brought to the forefront the importance of health investment in childhood towards a healthy adulthood. And as part of its effort to combating the deadly coronavirus, Nigeria again hopes to receive at least 70 million doses of the Johnson & Johnson COVID-19 vaccine this year through the African Union. A primary healthcare chief made this known to newsmen and concerns about delayed deliveries of the Oxford AstraZeneca shots. The National Primary Healthcare Development Agency has disclosed that it has vaccinated 513,626 Nigerians so far, representing a total sum of 25.5% of Nigeria's vaccine proportion. The agency disclosed this in a statement on Sunday evening. It reveals that Nigerian states are increasing the vaccination push. And Professor Iyala Evis Petusad, a Nigerian-born medical doctor, has been named one of America's best physicians for the year 2020 by the U.S. National Consumer Advisory Board and today's bestphysician.com. Petusad is a professor of pediatrics and neonatology at the University of Pennsylvania Medical School and a consultant at the Children's Hospital of Philadelphia. Considered one of the best children's hospitals in the world, where he has worked for over 20 years. This is TRS Television Network and you're watching Health 54. Stay tuned. Welcome back, and this is Health 54 on TRS Television Network. A man who had developed Ebola despite receiving vaccine recovered, but suffered a relapse nearly 6 months later that led to 91 new cases before he died. The report adds to evidence that deadly virus can lurk in the body long after symptoms end, and that survivors need monitoring for their own welfare and to prevent spread. With vaccination on the way, Ugandans have been warned of the possibility of the country being hit by another wave of the Covid-19 pandemic due to complacency. In her address to mark 1 year since the pandemic hit the country, Jane Ruth Aseng, the Minister for Health in Uganda, urges citizens not to abandon scientifically proven prevention and control measures and ensure to wear masks while in public, maintain social distancing, at least 2 meters, and washing hands with soap and alcohol-based sanitizers regularly. And President Cyril Ramaphosa of South Africa has said the country is expecting to conclude negotiations in upcoming weeks to vaccinate 41 million people, and the next stage of vaccinations to begin in May. In addition to 31 million doses of the one-shot Johnson & Johnson vaccine, President Ramaphosa said the nation is finalizing an agreement for 20 million doses of the two-shot Pfizer vaccine. And again, in Brazil, the country faces its biggest health system collapse ever, according to researchers at Brazilian Health Institute Fiocruz, as the country reports its highest number of weekly deaths since the pandemic began. Meanwhile, Chile has been forced to impose strict new lockdowns to cope with a severe second wave of infections, despite having mounted one of the world's fastest vaccine rollouts. Brazil recorded 18,164 deaths last week, bringing the total to more than 300,000, a higher toll than any other country except for the US. Many of the country's intensive care units have reached its capacity. The Nigerian government disclosed that the Japanese government is offering to donate the sum of $18.2 million to improve the Nigerian healthcare sector. This was disclosed by Clem Agba, Minister of State for Budget and National Planning, during an assessment visit over the utilization of the 49 billion naira intervention fund disbursed by the FG to 52 federal health institutes at the University of Benin Teaching Hospital on Tuesday. And Italian border forces have delayed a shipment of meningitis vaccine produced by British manufacturer GlaxoSmithKline, but was bound for America and suspicious that they could actually be doses of coronavirus vaccine in disguise. In yet another example of the tensions between the EU and Britain, over vaccines. It was reported that an estimated £7.2 million worth of freight has been held now for around 1 week by Italian customs officials at Rome airport, while they conduct tests to establish the shipment really is the meningitis vaccine, after some vials attracted suspicion after they were observed to not be labeled. You're still watching Health 54 on TRS Television Network. We will be right back. Welcome back, and still on Health 54. On the controversies surrounding the COVID-19 vaccine, experts have said that it might not be possible to say which of the available COVID-19 vaccines is the most effective to prevent severe forms of the coronavirus infection. China's health statistics report has shown that the new coronavirus is the second highest deadly infectious disease after HIV and AIDS among Category B infectious diseases in 2020. In 2020, China reported 87,071 COVID-19 cases and 4,634 deaths, with 6.2 infections and 0.33 deaths per 100,000 people, according to the annual report released by the National Health Commission. Report has also revealed that New Zealand's mental health system has worsened than what it was as at 4 years ago. Mental health experts had lamented that despite efforts by government to reform it and prioritize national well-being, the situation is far from finding a solution. And the public health officials in Washington said they are monitoring 23 people for Ebola who recently traveled from the West African countries of Guinea and the Republic of Congo. The Department of Health said Thursday in a news release that officials believe the individuals are at low risk, but regions in each of these countries are currently experiencing outbreaks of Ebola virus disease. An official report has also revealed that at least 100 people in Washington have tested positive for COVID-19 more than 2 weeks after becoming fully vaccinated against the disease. The Washington State Department of Health is investigating reports of the so-called breakthrough cases, which it said are expected with any vaccine. And that is Health 54 right here on your digital first Pan-African News Network, TRS Television. For more updates, visit www.trstvrnetwork.com to follow and like TRS Television Network on Facebook, Twitter, and Instagram. Remember to subscribe on YouTube. Do stay with us and enjoy more programs on TRS Television Network. Also remember, health is wealth. My name is Rose Audu. Until I come your way again, remember to stay healthy. Thanks for watching.